Yes, good evening, everyone.
Okay, I can see Chief already online. Good evening, ladies and gentlemen. This is Ask the Doctors. My name is Dr Frederick Unuigbokhai, and we always have this program every Sundays. Let me bring up our guest. Dr. Israel is here. I'm not alone. Usually have my co-host, Dr. Israel. Good evening. How you day? Hello, Dr. Israel. Can you hear me?
Good evening. I'm fine. Happy Sunday to yeah, I can hear you. Happy Sunday to everybody.
Yes. Happy Sunday, ladies and gentlemen. Welcome. So tonight we're talking about diabetes, and our guest, Dr. Patrick Adunbiola, consultant endocrinologist, is already in the house. So let's bring him up. Chief, good evening, sir. Hello.
Good evening, Fred.
Good evening, sir.
Chief,
How
good
Can you
you
hear
evening,
doing?
me?
sir.
Good evening,
Yes,
my
I can hear.
people. Fred, good evening. Good to see you.
We
Good to
can
see you. Can't you
we
hear
can't see
me?
you, sir.
Chief,
I can hear you. I can
You
yes,
hear
we
can't?
you
can
very
hear
well.
you. But
You probably just
but
listen
Chief,
to me.
we are not seeing your face, so
You want to see my face? Okay. But
Chief,
I
we
thought
want
I
to
was
see your
okay
face. So.
because I'm just wearing my jalabia. I thought I was okay.
No, yeah, you are very good like this. You are very good like
Yes,
this,
this,
sir.
yeah, at least seeing your
I,
faces, you are more okay than
okay.
you are very good.
Okay. Good evening, my people,
Good
and
evening,
happy
sir.
Sunday to you all.
Happy Sunday, sir. Welcome,
Good
sir.
evening,
Thank
Fred.
you
It's
for
been a long
joining us
while. Yeah.
tonight. Yes, it's been a very
Thank
long
you,
time,
Fred.
sir.
Thank you, Fred.
So, sir, the
Yeah,
reason
I'm
for
happy to be
tonight's
here.
discussion is that, there is so much discussion on diabetes. People don't know
Yeah.
about diabetes. We have what we
Okay.
think we know about diabetes. So, we deemed it fit to have an expert come tonight on this program that we have every Sunday by 8 p.m. To talk
Okay.
about it. And that is why we are honored to have you in our midst tonight.
No, it's my pleasure.
Without wasting time, sir,
Yeah.
let's start quickly on diabetes. What exactly is diabetes?
Okay. Thank you once more. Diabetes have been defined. I will quickly just define it and probably explain. Diabetes has been
Okay.
defined as a disorder of multiple etiologies. That etiologies are causes.
Hmm.
So there are a lot of causes of diabetes, which I will expatiate on as I go along. It is characterized by chronic hyperglycemia. And what's hyperglycemia? That means elevated blood glucose. And it's not just a one-off thing, it has to be there for some time. And what is causing this is problems with insulin action or their secretion. And like most people will think, it results in problems with both carbohydrate, proteins, and lipids. So it's not just carbohydrate alone. So it is a chronic disease. It is caused by problems with insulin secretions or its actions. It is characterized by chronic hyperglycemia, and if not treated on time, would lead to complications and even death. Now, what are the causes? I quickly run into that. When they
Okay,
say
sir.
multiple causes, they mean that it's not just one cause. That is why it is a complex disease. It has a lot of causes. And the knowledge of these causes is what will enable you treat the disease appropriately. And so you have what we call the type 1. This is due to autoimmunity. And what autoimmunity, I would say, is a medical jargon. And for the other people, is that the body at times just decides to fight itself. And in this type 1, the body fights the islet cells that secretes insulin. There are a lot of reasons for that, which may be outside the scope of this discussion. That is type 1. And so this type will come up in persons who are young, but because of, okay, let me just talk about type 2. Type 2 is mainly due to insulin resistance. What is insulin resistance? Like I said initially, that it can be due to problems with insulin secretion or its action. The type 1, the insulin cells are destroyed, so there is problem with secretion. The type 2 that I've just talked about, you have insulin is being produced, but where it's supposed to act, it cannot act. And what causes this? That's insulin resistance. So what causes this is mainly due to overweight. It's mainly due to overweight. And what leads to overweight is what we call sedentary lifestyle. In fact, I think more emphasis should be placed on this type 2 because like 95% of diabetes you see around is actually type 2 diabetes mellitus. And so much emphasis should be there because it is the preventable type of diabetes. So what happens here is that people, because of lifestyle in recent times, now adopt what we call a sedentary lifestyle. Like I sitting down now watching my telly, I work with my remote, I change my channels with remotes. I wake up in the morning, I drive my car to work, come back. Virtually everything we do are now mechanical. We don't really do things again. We have things that help us to do things. Because in the past, when people were using old televisions, they could stand up and change channels several times. And those little steps are actually exercises. But that is lost these days. And so you have that people are sedentary, they don't exercise, they grow fat, and in the end, you have that increased weight leads to insulin resistance. That is what causes type 2. Now, people have in the past said that type 1 is younger people, type 2 is older people. But we can't really give that distinction now because of these same lifestyle changes. Because nowadays, you find younger people, again, because of the same change in lifestyle, get so fat, and they can develop type 2 diabetes. So there is no clear distinction. These days, you are beginning to see younger people at the age of 15, they have diabetes. You would think it's type 1, but then it's type 2 because they have insulin resistance at that age. So that is type 2 diabetes. You have gestational diabetes. This is diabetes that is first discovered during pregnancy. These people ab initio do not have diabetes mellitus, but during pregnancy, they are detected to have diabetes mellitus. This form is actually due to what we call anti-insulin hormones that are produced during pregnancy: progesterone, estrogen, lactogen, placental lactogen hormone, and the rest of them all. So what this hormone does is that they antagonize insulin, and so they reduce the effect or the action of insulin. This form of diabetes can recede after delivery. After you deliver the placenta and those hormones are out, it can recede. But what this just tells us is that such persons stand a risk of type 2 diabetes mellitus in future. And so they should be persons who should watch it. Now, a percentage of such persons who have GDM, gestational diabetes mellitus, may progress on. After delivery, they may not revert to normal glycemia. Normal glycemia are persons who are just normal, their blood glucose is normal. They may not revert to normal glycemia, so they may progress to type 2 diabetes, while other percentage may revert to normal. But for those who revert, that just tells you that you stand a risk of developing type 2 diabetes later on in life. And so, more than every normal persons who do not have diabetes, you need to watch it and do routine checkup. Those are classic types of diabetes. Can you hear me?
Hello? I can hear you loud and clear, very loud and clear.
Yeah. Now, when you have, after these three major, the WHO have now said other specific types of diabetes that are caused by numerous etiology, starting from diabetes can be due to drugs like steroids. And here again, we have to tell our people that just going over the counter to procure medications can actually cause damage. In fact, we've seen people who come in with diabetes, and when you ask them questions, they've been taking a lot of drugs, most of them for arthritis, that's steroids, and some other medications. And they take it over a long time, and that these drugs have done a lot of damage to their pancreas, and they thereafter develop hyperglycemia and diabetes mellitus. That is one form of diabetes. Drug-induced diabetes mellitus. Diabetes can be due to disease of the pancreas. There are other diseases that affect the pancreas. that can cause diabetes. Diabetes can even be due to childhood malnutrition. Persons who have childhood malnutrition can now have chronic pancreatitis and thereafter develop diabetes mellitus. Diabetes can be due to other endocrine diseases like Cushing's, acromegaly. So the person have other diseases and in the process have chronic hyperglycemia and then have diabetes mellitus. Diabetes can be linked to syndromes like Turner syndrome. And so you see, that is why we say it's a disease of multiple etiology, and the knowledge of this etiology will enable you to treat the patient so well. For example, if you have a patient who has diabetes due to steroid use, and you just didn't take a good history, you don't know this, and you keep treating the patient while the patient is still taking the steroid, you obviously will not be doing the patient any good. And so that is why a good history and knowledge of diabetes itself is essential for appropriate and good treatment. Maybe we'll just stop at that while we go on.
Thank you very much, sir. If you are just coming, you're welcome. We're talking about diabetes tonight. We have Dr. Patrick Adunbiola, consultant, physician, and endocrinologist, talking to us about diabetes. Now he has defined what diabetes is. We have type 1, type 2, gestational diabetes that occurs during pregnancy, and other types of diabetes. Before we go further, sir, I want to ask this question. What is the relationship between family member with diabetes and an individual coming down with diabetes?
Yes, diabetes, especially type 2 diabetes, is linked to, it's not what we call inheritance, but persons who have family members who have diabetes stand a higher risk of developing diabetes. So it's not like an inheritance per se, but they stand a risk of developing diabetes. And so the person who has just the father having diabetes stands a risk of developing diabetes. Once you have the two parents, you stand a higher risk of developing diabetes mellitus. And once you have more siblings, you stand a higher risk of. So you are at increased risk when you have family member who have diabetes. You won't call it inheritance per se, because if you do preventive measure, you may not have this diabetes mellitus. You stand a risk, but it can be prevented. If you adhere, if you do preventive modalities, it can be prevented. So it's not like you must inherit it, no, but you stand a risk. And that is why we tell persons who are such that they stand a risk and they should watch it even more than the other general population.
Okay, thank you so much, sir. Let's go further with the symptoms of diabetes. Commonly, people know that when you have diabetes, they say this common complaint, I urinate often. From the expert perspective, what are those classical symptoms of diabetes that we need to know and look out for?
Now, we've said that, okay, maybe I will just group them. Diabetes can be asymptomatic. It can have symptoms. Asymptomatic is just that you don't know that you have diabetes. Like it's a silent killer. It's something that you don't know. In fact, for type 2 diabetes, by the time you start having symptoms, about 50% of the pancreas have gone before you start having the symptom. So it's a silent killer. And so you may not have symptoms. You find out that some persons just go for routine medicals and they do their screening and find out that their blood glucose is elevated. On that first occasion, we really don't label them diabetics. They need, in the absence of symptoms, they need to have another blood glucose check. So 2 or more blood glucose checks in the absence of symptoms makes them diabetics. Now, some other persons may have symptoms. Yes, we usually say that the classical symptoms are polyuria. That means you are drinking, you are urinating excessively because you have a lot of glucose in your system, which cannot go into the cells. And this glucose, of course, in science, there's osmosis. So they draw in water to itself, and that way you urinate it out. So you urinate a lot. It's both frequency and volume. So you go to urinate many times, and it's much. Unlike frequency, where you go urinate small volumes, you come back just very quickly, you want to go back to urinate. That is frequency. But here you're having polyuria, you go to urinate frequently and of large volumes of urine. Because you are urinating excessively, you tend to go dry, that is dehydrated, and so you drink a lot of water. That is polyuria. That is a symptom. You just notice that I'm beginning to drink water excessively. It tells you that you probably may have diabetes mellitus. Because the blood glucose is in the blood, it doesn't go into the cell. Even though you are eating, the cell does not get this food, this energy, because the glucose cannot, or the food, the end product of food cannot go into the system. And so you feel hungry each time, even though you are eating. So you tend to eat more than usual, more than normal. And because you are not getting these cells in, you are not getting the glucose into your cells, you are fatigued. Your cells are fatigued, so you are tired. So those are what they call the classical constitutional symptoms of diabetes. You get them in type 1 frequently, but not everybody will have these classical symptoms. That is the need that at certain ages, 40 and above, you need to check your blood glucose regularly. Because some people for the first time will present with complications of diabetes. For the first time, they don't know that they have diabetes before, and suddenly they just have a wound on their leg, a blister on their leg that becomes so bad, and they've treated everywhere, and they now present to the specialist, and you find out that this person have diabetes. It's not has the classical polyuria, the polydysphia, it didn't have. It just presented with complications. You find out that some persons will stay and just come to tell you that, doctor, I have tingling sensations on my legs and on my hands. And because that is neuropathy, you just screen the patient and you find out that this patient has elevated blood glucose. You find out that some men will just come and tell you that, doctor, I cannot sleep with my wife the way I used to sleep with my wife. Nowadays, if I meet my wife, before you know, I am down, I don't have a good erection, that is a complication of diabetes. And they've not had this classical symptom before. This is the first thing that they are presenting with. So what I'm saying is that diabetes can present first with those classical symptoms that we've talked about. And at times, those classical symptoms may not be there, and they just present with complications. I'm sure there's a place for complications when we talk about complications. So I just mentioned a few of them. Then other people, diabetes is a disease that reduces your immunity. So you find out that whatever the normal population are suffering from, the person who have diabetes, his or her symptoms are worse. They are more virulent. It's worse, more virulent. And it takes a long time to cure the person, unlike ordinary people, persons who do not have diabetes mellitus. Those are part of the symptoms that they present with. Those are the symptoms. But like I said, most persons that you see would at times, or many people that you see would at times not have symptoms. On routine check, they just find out that they have diabetes mellitus. So those are the asymptomatic people. Those are the symptoms of some of the symptoms of diabetes. Okay.
Yes, sir. Thank you very much. Dr. Israel, can you hear me? Okay, let's.
Yes, I'm
Let's.
with you.
Okay. Okay, go ahead, Dr. Israel. Go ahead quickly.
Okay. Thank you very much, sir. You've given us the causes, the symptoms, and I think we'll be talking about the treatment before the complication. Or let's talk about we'll talk about the treatment before the complication and then the prevention. Because I've noticed Chief have always been talking about prevention, and also we should also remember that medicine is also tilting towards that line to prevent occurrence of some diseases that can be preventable, mostly the type 2 diabetes. So, sir, please can you tell us how we type 1 and type 2 can be treated, and also let us know if they are curable or not? Thank you, sir.
Thank you. Like I said, type 1 diabetes is an autoimmune disease. That means the body has destroyed the cells. There's nothing you can do about it. And the problem with that is that the insulin that the body requires Insulin is actually is required to move when you eat carbohydrate. Let me just start like when you eat carbohydrate, it goes down to glucose, and this glucose must go to the cell to work. But you need insulin to move this glucose into the cell. And so this insulin is lacking. And once this insulin is lacking, the glucose cannot go into the cell. And so the cells will not have nutrition. Now, insulin is totally lacking in type 1. And so you must give back the insulin. And that's why treatment for type 1 diabetes is insulin. There is no room for oral medications. There's no room for tablets. It's insulin. You give back the insulin that has been destroyed. That is treatment for type 1 diabetes. And there are various forms of insulin available. Various forms of insulin available. There are more, the ones that makes you more comfortable. They're in pens, and you can put it around and move to work with it. Take it when you want to take it and come back home. Unlike in those days that we have the one that you must bring out a syringe to withdraw, and so there are more patient compliant or patient friendly devices that can deliver insulin. Now for type 2 diabetes, the problem is not with the secretion of insulin. The problem is the action of insulin, where it's going to work. And so there are medications that help it to work better. A lot of medications exist. A lot of different. And that's why, as experts, we take into consideration a lot of things while we are prescribing medications for the patients. Now, like I said, for example, we know that patients who have type 2 are most times obese and big, overweight and obese. And so in our choice of medications for such patients, we tend to give the ones that will be weight neutral. They won't make them add, because some would actually make people add weight. We tend to choose one that will not make them add weight. And if there are some that will make them lose weight, we add those ones to it. In our evaluation of patients, we also evaluate patients who have cardiovascular disease. The one saying diabetes, like I said, causes a lot of problems. And so there are persons who would have cardiovascular diseases. And so there are choice of drugs that will benefit those who have diabetes and cardiovascular disease, those who have diabetes and problems with lipids. So there are an array of medications, oral medications, that are available for type 2 diabetes patients. But I must stress here that for everybody who has type 2 diabetes, if they should live long enough, will at one time or the other require insulin. And that once your doctor prescribes insulin for you, to you, it's not a death sentence. No, it's just that at a particular time you require insulin, because the drugs we are giving to you will at one time or the other, the cells that are the remaining cells will be burnt out. And so in that case, you will require insulin. So for our patients who have, we tell them that, look, a time will come when you will need insulin. At such time, don't think it's really that, because people, it's a myth that people say, once I start insulin, my condition is now bad. No, it's not as if it's bad. It has just gotten to a stage where you require insulin. Some other people think that once they say I should start insulin, it means that I have not been doing well on my own. No, it's not as if you are not. You have just gotten to a point where you will need insulin in life. And so once you have diabetes, type 2 diabetes, a time will come, and with good medical facilities and people now being health conscious and live long, a time will come when you would always need insulin. So we prepare our patients' mind down, and that a time will come when they will need insulin. And for those who have type 2 diabetes, there are times that stressors would make them require insulin. And once you treat them, they have stress, they have infections, they are going for surgeries, they have new ulcers. At such times, they will need insulin. And so we take a break from the orals and give them insulin. Once that is done, we can take them back to the oral. So basically, that is what we do. But like we said, diabetes is not about glucose alone. Diabetes is not about. So we say these days that we are not glucocentric about treatment of diabetes. It's a disease of multiple etiologies. So we tend to target all those etiologies. And so lifestyle changes is an integral part of the treatment of diabetes mellitus. In fact, in hospital settings, Just the expert endocrinologist does not treat diabetes alone. I treat diabetes. I have a dietitian sitting by my side, usually. And these days, I do a little lectures on exercises today. I tell them different types of exercises, the ones that are aerobic, the ones that they can do, because those are important components. If I start giving my patients drugs alone and the diet is not well regulated and it's not exercising, I will not be getting anywhere. And so those are integral part, and that's what we call medical nutrition therapy. Exercises and drug therapy are the three hallmarks in the treatment of a patient with diabetes. Drugs alone will not do it. And so the patient must also know this from diagnosis that, look, I'm going to be giving you drugs. It's an interactive session. If diabetes is a disease where you don't just do your prescription and go, you discuss with the patient. You set goals, you set targets for the patient, and you monitor the patient as it gets to those goals. It's one disease where you set goals. Like, in the next 3 months, I want your blood sugar to be this. In the next 4 months, I want your HbA1c to be this. Can you do it? And they say, sir, this may be too strenuous for me. Say, okay, what can you do? And the patient tells me, this is what I can. Okay, let's go. As the patient is seeing the improvement in what he's doing, he's encouraged more. So it's more like an interactive session. The patient plays a vital role in his own management. But again, I must stress that it's not just drug treatment alone. Medical nutrition therapy, that is nutrition generally, and exercises are a key component of the treatment of diabetes. And like I must advise our own patients, like the way we practice here, have patients, especially the age, we stress them and know the exercises they can tolerate, and we tell them, prescribe them, depending on, no matter how weak you are, there must be some things you can tolerate. Even if it's just walking a few steps, you must do something every day. And that's what we tell our diabetes patients. Key part, nutrition, exercises, medication. No one of them is all in all. We must do the three together. And we must also take care of, like I said, it affects lipids metabolism, it affects protein. And so most of these patients find out that they have dyslipidemia, especially triglycerides. So we take that into account. So we are looking at everything in all. Their blood pressure control must be more optimal than the normal population. And so those are the things we are targeting in management of patients. For the drug treatment for diabetes itself, like I said, type 1 insulin, type 2 drugs. And that every type 2 who lives long enough will at one time or the other require insulin and will at the end require insulin.
Thank you very much, sir. Like Dr. Israel asked, let's briefly help us talk about the complications. For those who are just coming, for the symptoms, you might have to watch this video again from the beginning, the symptoms and the causes. We have gone past that because of time. We've talked about, Dr. Patrick has spoken about the causes, the symptoms, and the different types of diabetes. So you might try to watch the video again, you will know all this. So, sir, please help us. What are those complications of diabetes that we need to know?
Yeah. Thank you, Fred. The complications of diabetes, they are numerous. So, but I will just try and go through them. And like my teacher would usually tell us was that diabetes, you have glucose in your blood and the blood flows. So anywhere blood goes to diabetes can cause a problem there. The glucose is in the blood, so it's flowing around all over. So anywhere that blood will get to diabetes can cause a problem. So that just gives us an idea of what the complication of diabetes is. But then basically, we group the complications of diabetes into acute and chronic. Hello, are you with me?
Yes, sir. We can hear you, sir.
Okay, so the complication we group them into acute and chronic. The acute complications are the complications that arise just quickly. They just arise. You can treat them and they are soft. The problem is soft. While the chronic ones are the problems that have been on for a very long time. In fact, at times, it's been on before you even make the diagnosis of diabetes. And so the acute one we have, they are mainly hyperglycemic emergencies. They can be diabetic ketoacidosis or hyperglycemic hyperosmolar states. In these ones, the patients, they can present for the first time with all these complications since they don't know they have diabetes. Or there are patients who we have seen prescribe medications, but they are not compliant. They don't take the complication. They don't take their medications. You can also have that when they have a stressor, because once you have a stressor, your blood glucose tend to go up. And so those stressors can be infections, it can be myocardial infarction, a lot of stressors, a lot of them exist. And so once they have that stressor, their blood glucose transiently rise abruptly up. And so they can present with coma. And so once this patient comes, we treat them and they can get healed of that condition. Those are acute complications. The other acute complications are actually those that can come from treatment. Of course, complications can come from the disease itself or from treatment of the disease condition. And that mainly is when you give medications and the blood glucose goes down. That's what we call hypoglycemia. That is also a complication. And so what we tell these patients there, we tell them and we let them know this, because inevitably they may have hypoglycemia. We let them know the symptoms of hypoglycemia and when they have such symptoms, how to help themselves. And what are these symptoms? You find out that you're having palpitation of your heartbeat, you are aware of your heartbeat, you are sweating profusely, the patient has tremor, and at that stage, the patient should be able to take a glucose drink and the blood glucose will be restored back to normal. And having done that, the patient should now visit his or her doctor and explain to the doctor who will now do an adjustment on the medications. So that is hypoglycemia. Now, the chronic ones are the ones that are really worrisome because they are the ones that are going to be progressive and they're the ones that are going to lead to death. I start from the brain. They can have a stroke. They can have dementia, vascular dementias. I come down to the eyes. They can have retinopathy. In fact, it's a leading cause of blindness. They can have cataract. We come to the heart. They can have different varying degrees of cardiovascular problems, from ischemic problems, cardiac infarction. They can even have diabetic cardiomyopathies. We come to the abdomen. They can have constipation. They can have nocturnal diarrhea. They can have leg ulcer. In fact, diabetes is a leading cause of amputation worldwide. So they can have chronic ulcers, what we call diabetic foot ulcers, that will refuse to heal. They can have neuropathies, and you just see people say they have numbness on their feet, they have peppery sensations on their feet and their hands. Those are neuropathies. They can have erectile dysfunction, which I already explained earlier. They can be prone to having furuncles. The women can have candidiasis, vaginal candidiasis. So it's a whole lot of issues. They can have menstrual irregularities. It's a chronic disease. They can have menstrual irregularities. So those are part of the complications of diabetes. In fact, most people, I hope I'm not forgetting to mention, it's a leading cause of chronic kidney disease. It's a leading cause of chronic kidney disease. Those are some of the complications of diabetes mellitus.
Thank you very much, sir. There are some questions pouring in. We'll go through your questions very soon. Before we go to your questions, we just have a few more to ask our guest tonight. So, someone has diabetes, the person is listening, or has a family member with diabetes. What would be your advice? Most times we know that people don't like medication. I don't like taking medication for life. But generally, what would you advise anyone who has a family member with diabetes or battling diabetes? I guess we had Dr. Israel. Okay, Dr. Israel is here. I guess we had a little issue with Dr. Patrick's network.
Yeah,
Hello, sir.
I have quite said a lot.
Yes, yes, yes. He mentioned the complications are so many. Uh, but somebody was asking us about the symptoms, so we could just take them for you till we get Dr. Patrick back. So he spoke
Fred, I'm
about.
back.
Okay, okay. Yes,
Fred,
welcome, sir.
I'm back. I didn't
Yes.
get your first question.
Okay.
Sorry, my
So
network
my
was.
question was, we'll be coming to your questions for the audience very soon, sir. For someone that
Okay.
has a family member with diabetes or somebody
Yeah.
battling diabetes, what would you
Yeah.
advise that fellow to do?
The caregiver.
Yes,
To advise the caregiver.
most especially at home. Now, this is no longer at the hospital. The person has been managed now at home. What would be the
Okay.
brief advice? Yes.
Well, the advice is one, again, I tell my patients that they should learn to live, they are normal persons, they should be able to live their normal life. And so, no restrictions. Now, I expect everybody who has diabetes to have gotten a quality dietetics advice. So, it's to adhere to the advice, adhere to medications, and follow up. And like I said, uh, I would not be able to prescribe exercises for persons here because before actually you need to embark on exercises, you need to do some investigations, at least to be able to know the exercises that the person can tolerate. So I won't be able to do a prescription. But what I would just advise that person is that to seek regular medical um, advice, medical help, if possible, through a specialist, and adhere to the instructions, both dietary and lifestyle modification that would have been given to the patient. Except there are specific things he wants to ask about.
So we have a question from Awilala Udo. Says, what are the ways to prevent it?
Okay. Like I said earlier, type 2 diabetes is actually that form of diabetes can be prevented. And what you can do is lifestyle modification. And what's that? Is we encourage persons to exercise at least 30 minutes every day for most days of the week. So that will be for at least 5 days. 30 minutes every day for 5 days. Watch your diet. Everybody, like we keep saying, everybody, whether you have diabetes or not, should eat reasonably. You should not eat, let me not say over food, but watch your diet and try and avoid meals with high calorie, so to say. Avoid meals with high calorie, at least that's for a normal person, and try and maintain an ideal weight. That is the best method for it. Then, most importantly, you need to do your blood glucose annual checks from, say, the age of 40, because there is a forerunner of diabetes. That's the pre-diabetes. At this age, if you detect persons with pre-diabetes, there is room for this lifestyle modification and medication if possible. And as such, if that is vigorously adhered to, some of these persons can revert back to normal glycemia. So they should do from the age of 40, say, they should do routine checks, maybe annually. And I would advise those who are at risk. They are at risk now are those who have a family history, those who are overweight, those who are probably on medications that can cause diabetes, to do. So if everybody is doing annually, checks annually, such persons should do every 6 months. So that this disease, if they are pre-diabetes, measures will be taken very quickly to revert them back to normal glycemia.
Okay. We have another question
You
here
see,
from.
okay,
Yes,
okay.
yes.
No, you see, like my boss used to say that in Lagos, for example, most of you are in Lagos. That in Lagos, there you can, if you enter a bus, you can drop at one bus stop before your bus stop and decide to trek home. If you
Oh,
have a
yeah.
car, if you have a car and you go to church, you can, and the church is close by, you can decide on some days to trek to church. So those are modalities that you can take to prevent this disease.
We have another
Okay.
question from Sugar Lacy. It says, can stress cause diabetes? Stress, different forms of stress.
Stress cannot stress. Well, no. It's not a non-cause of diabetes. And it depends on the stress. You can, but if stress is going to do anything, it can cause a transient rise in blood glucose, but it won't be sustained. It won't be sustained. So it can't. It won't be sustained. So for diabetes, the blood glucose elevation in blood glucose hyperglycemia would have to be sustained. There are persons who just have they are ill and they quickly have a blood glucose, it's high, but the next day is just normal. They don't have a sustained one. So stress, no, it's not a known cause of diabetes.
Okay, you've heard Dr. Adunbiola, stress is not a known cause of diabetes. And this question here looks very funny, but okay, let's just take it, sir. Can one contact diabetes through sex?
Not reported, no. No,
Not reported.
not reported, no. Not. It cannot, you cannot.
Okay, you've heard Dorcas,
You cannot, it
not
can,
reported.
no, no, you can't get it through. It cannot get it, it's not, there's not, can't get it through.
Okay, I don't know if Dr. Israel, you have any question? Because I still have more questions to ask. So many that have been sent to me privately.
No, I don't. Because I missed some part.
Okay.
I believe any question I would want to ask, Chief would have answered them already. So I don't think I did.
Okay. Sir, I want to ask one question. Social media is a very different world entirely. And we see people being promised a whole lot of cure for diabetes. They will tell you to drink this solution, drink this tea. In your years of practice and with research through literatures, have you come across any tea in whatever form? I don't want to mention herbal concussion, herbal tea. Is there any
There's
tea out there that can actually cure diabetes?
no, Dr. Fred, there's no tea that can cure diabetes. There's nothing that can cure diabetes. You see, some persons actually at times, you see, they can have, persons who have diabetes can now be having low blood glucose or even normal blood glucose. That may not be a cure because we know that persons who have chronic kidney disease are prone to having hypoglycemia. And so you find out that some patients, you'll be treating them and suddenly their blood glucose is now normal or they are requiring less medication to us. So what we do as doctors is that we search for why would this blood glucose be normal. And in some cases, we find out that the patient is already has CKD because the kidney helps in metabolism of insulin. And so once it's diseased, the insulin there cannot even be multiplied. And so it stays in the body and keeps working. And so people can have erroneous belief that my blood glucose is now good or is now good, not knowing that there's a sinister thing happening underground. And so there is no tea that can cure diabetes mellitus.
So you've heard there is no tea that can actually cure diabetes. If anybody promise you any miracle cure, please, I beg you, speak with the experts. One more question again, and this is like a misconception that we keep hearing. You hear people tell you that if you drink any substance that contains sugar, you would come down with diabetes. What is the relationship? Does sugary drinks, your soft drinks, or generally what we drink, does it cause diabetes?
They don't cause diabetes like that, but it has an indirect link. I said something about insulin resistance. Now, the sugary drink have increased calories. And the more you take this, the likelihood of overweight and obesity. So that indirect relationship is what exists. But on its own, no. But of course, with the increased calorie, increased weight, the likelihood of insulin resistance is there, and they now have diabetes. So that is the link. Okay. And so we also discourage people who are normal glycemia from taking excess of such drinks, because they stand a risk of having increased calories, increased weight, increased insulin resistance, and a type 2 diabetes. That's the link.
Okay, thank you very much. If you have questions on the topic, please drop them down so that we can take them. I want to ask, in your practice, what has been the most sad, is it sad or troubling case with regards to diabetes that you have seen our people practice at home that led you to a state of being very pained with regards to diabetes? I don't know if you've come across any that troubled you or made you feel angry, if I may use the word.
Yeah. Yeah, one, in fact, there are a lot of things you see every day, and you wonder why people do that. For example, this tea we talked about. People take tea, different tea, and say they have cure. Meanwhile, they are not even checking their blood glucose as they are taking that tea, and they come back later with chronic kidney disease and other things. Why have you? They are your patients usually, and they just live for like 2 years, and you don't see them. And suddenly they come back in the ward, you see them on admission. "Ah, what's that, madam? What's the problem? Yeah, you've not been coming for checkup like yes. So somebody told me that this can work, and I've been taking it. I wasn't checking my blood sugar, and they now. And now, so I tell them that even if you are checking your blood glucose at home and it's normal, a doctor's appointment is important, because he's not just going to look at that blood glucose. He's going to assess other things. He's going to do your urinalysis and see that if you have protein in your urine, these are early warning signs. He's going to look at your feet. If you have fissures, calluses, warning sign. He's going to tell you when you walk into to his consultation, he's going to say, yeah, these slippers, I've told you not to wear this kind of slippers again, because it's going to cause you food ulcer. So he's going to tell you all those things. He's going to check your blood pressure. He's going to check your lipids. Those are other things that even if your blood glucose is normal and those are not addressed, they increase mortality for persons with diabetes. And now, the other thing that I have seen most frequently, I don't know if it happens, is that people take medication based on symptoms. We see people here who just take medications and they come in with hypoglycemia. They are not diabetics. Most of them have frequency from prostatic bladder outlet obstructions. And what I just say is that my friend said that he was urinating, he was urinating many times. So I'm also urinating many times now. And this is the drug he was taking. He takes the drugs. Give me go to this chemist, buy this drug. This is the drug I'm taking when I was urinating, and they say it's diabetes. And he concludes that he has diabetes. And he takes such drugs and he comes in with hypoglycemia. And we have seen patients who have diabetes, who have taken native medications, and those native medications are drugs, medications, oral medications that have been outdated, like glibenclamide, that causes terrible hypoglycemia. But those native, they grind it there, put in there, we've seen them. The patient come with, at times, with irreversible brain damage from hypoglycemia. And so that is why we keep advising that people seek medical care. Why we ask you to seek your glucose can be normal. Anybody can tell you that you have diabetes, use a glucometer and say, your blood glucose is normal today, and say, okay, take this drug. But you need a physician, you need a specialist to be able to look at other things that add up to the mortality of persons with diabetes. So that's why we're there. Even those, because some persons will come and tell you that I've been checking I have a glucometer at home, I've been checking my blood glucose, it's normal, it's been normal, and at the last minute you see them coming with myocardial infarction. And once you do their lipids, you find out that the triglycerides and other lipids are very high. Of course, if they're coming to clinic, you would have probably started them on something to prevent that. But they weren't coming. They were just glucose. That's what we call glucocentric. They were just on their glucose, my glucose. So my advice to people is that diabetes, like I said, is a disease of multiple etiologies. So it's not just the glucose that we are looking at now. We are looking at every other thing that causes mortality in a patient with diabetes. And that is why it is good for them to see a specialist who will check all these things, who will look at all these things and ensure that they are all right. If you look at glucose, you can go to anywhere and check your blood glucose and it's normal, you keep moving. But the lipids, are they normal? The HbA1c that we are using to monitor compliance and to assess whether you're at risk of complications, can you do them elsewhere? Can somebody else interpret that HbA1c So that is why they need to see a physician.
Thank you very much, sir. We have a question from Rachel Ido. He says, okay, this was taken before. How many types of diabetes do we have? Okay, this was addressed in the early part of the discussion. What is the difference between those who are using tablets every day and those who are injecting themselves? Or do they have to take that long injection every day? Thanks.
Okay, if I get, well, we said something about it earlier on, that those who have type 1 would take the long injection every day. Those who have type 2 would are the ones taking the tablet. But at times, those who are taking the tablets may have intercurrent infection, may have other stressors, and they will need that long injection.
Mm.
And that those who are taking this tablet, if by the grace of God they would live long enough, there will come a time that they will also need that long injection. I hope that's clear.
Yeah, very, very, very clear. So you can also watch again from the beginning, you get more insight. So Favor is asking, can bitter leaf water reduce blood
No.
sugar? I hear this a lot. I hear
I hear
this
it a
a
lot
lot.
too, but I don't. No, it can't. Not it can't.
But sir,
It can't.
why do people mention this? Because you hear people convincingly with so much conviction that I took bitter leaf water and my blood sugar was
but
down.
well, I also hear that. I really don't know why they mention that, but there are a lot of variables that can affect blood glucose control. So maybe they are taking that bitter leaf, they are still taking they're taking their bitter leaf and exercising now well, or they're taking that bitter leaf and their dietary measures are better. I really can't tell, but nothing has been isolated from it so far that tells that it has a blood glucose lowering effect.
Okay, so Favor, you've heard, bitter leaf water does not reduce
But like
blood
I
sugar.
said, once somebody has diabetes and suddenly you are using other things and you find out that your blood glucose is now low or even normal, you need to do other checks to be sure that everything is okay, that is now low
Mm, mm.
or normal. Most importantly, your E and U creatinine and other investigations.
So it's
At
not just
least
about
once
the sugar alone. There are other things that
know
must be
other
checked.
things that checked, yes.
Okay, very good. Sir, what is the financial burden for the management of someone with diabetes? Because people just say diabetes. If someone is really diabetic, what is the journey like? Is it something that can wreck the bank if adequately
It can
managed with medical?
it's a disease of huge burden. In fact, just before I came, in fact, even in the US, people who even have insurance, they still spend a lot of money, not off here. Because one, I just look at, I don't, there are a lot of works on burden of diabetes, even in Nigeria, if you check. But you just watch that a patient.
Oh, what happened? Network. Oh. Let me see. Let me add Chief back.
Can you hear me? I
Hello,
can hear
sir.
you. I can see you.
Yes,
I
yes,
can
yes,
see you.
yes. Okay, I can hear.
Yes, I say
Okay.
most persons who have it's really a disease of financial burden. So it's really a disease of financial burden. I can't quote the experts now, but I can tell you that of the patients who come to clinic, the patient with diabetes has to get a lot of medications. It's getting mentioned most times they have dyslipidemia, it's going to get medications for that. They have hypertension, it's going to get medication for that. They have neuropathy, they're going to get medication for that
Hmm.
before getting the medications for diabetes. But then these are
Okay.
still cheaper. You need to still get all this than when it comes to complication. Imagine a complication of CKD and patients on dialysis and need a renal transplant. So yes, it's a disease of huge financial burden, but then it's still better to do that than to end up in complications. Because dialysis, we know the cost of dialysis, and that is something you need to have frequently. So I still advise my patient that yes, while we know that things are hard in the country, you still have to try. And you cannot say you just want to do your blood glucose control. Once that is good, no. If the lipids are high, there's increased mortality. So you need to control that. The blood pressure is high, you need to control that. If you have neuropathy, it's really discomforting, you need to take care of that. So it's quite a disease of huge financial burden on patients. And so
Thank
at
you very
times
much.
we tend to that if we have different forums that we appeal to the government that whatever they can do to subsidize this, like it's done in other climes, government should really help. Because the IDF people said that most of these persons who have diabetes from the International Diabetes Federation live in poor and developing countries. So that has been recognized. And so you find out that persons know they have diabetes, but of course, there's no money for care, and they come in most times with complications. And that is something that if you take care of it from the beginning, the chances of a good life, a good quality of life is there. But because of poor finances, most patients cannot really get good quality of life because they can't afford their medications. And so we advise, and we hope that you can use your fora to also advocate for government involvement in the management of persons with diabetes.
Thank you, sir. We'll do our best. We have so many questions coming in. Ladies and gentlemen, please share the live stream. Let's take a few questions before we round up tonight. We're almost out of time. Can people with liver disease, okay, are they at risk of diabetes? People with liver disease. This is from Ajoke.
So what? Sorry.
People with liver disease, are they at risk of diabetes?
They tend to have more of hypoglycemia complication. But then again depends on what is causing the liver disease. If it's an alcoholic liver disease, the same thing can happen to the pancreas to cause chronic pancreatitis, so they can have diabetes. You understand? So they are interrelated. The patient have alcoholic liver disease can also have chronic pancreatitis, and in that way can have diabetes. Is that clear?
Okay. Yes. Very, very clear.
Hello?
Can a diabetic
Okay.
drink low-calorie alcohol once in a while to calm the nerves? From Alex.
We don't advise that. We don't advise that. We don't advise that.
A diabetic should stay away from alcohol. Okay. Sugar Legacy is asking us, can depression or anxiety cause diabetes?
Anxiety or depression, depression can it can interrelate. If you have depression and you are not eating, or you have depression, you are overeating, they can have different moods, but it's not linked. Depression is not linked to diabetes directly. It's not linked to diabetes.
Okay, the questions are pouring
It's not.
in. We'll just take some that we haven't addressed before. Okay, I'm going to take this because there's a part that
Rather, diabetes being a chronic disease can cause depression.
Yeah,
we have seen that. Diabetes being a chronic disease and all of this can cause depression. It does. We see a lot of them.
But depression cannot
really cause diabetes.
How about the medications used for the management of people with depression? Is there any relationship between those medications and diabetes?
Not the ones that I know, but management that are psychotic drugs that can cause it, not depression per se, like chlorpromazine but the newer antipsychotics do not. But the other ones like chlorpromazine and the rest, yes, can cause diabetes. They do. Those are some of the drugs that cause them.
We have taken the symptoms. You might have to watch the video again. So it's asking, at what age can one begin to check his or her blood sugar for screening? Let's say annual screening.
I usually tell people 40, but then if you're at risk, if you assess your risk, you can start earlier. Usually tell people if you assess your risk, you are fat, you are overweight, you should check earlier. You have family members who have diabetes, you should check earlier. At 40.
You have to risk check earlier. But if you have no risk from 40, for the symptoms, please watch the video again. A doctor promised to cure my mom of her diabetes. Can diabetes be cured? I don't know which doctor is that.
No, I that would be good to share, but I don't. Diabetes cannot be cured. That would be good to share.
Yes, please share with us. Cure. The word cure means disappear. You know, there's nothing like that. We've been told tonight.
So cure. There's no cure for diabetes as of now.
Okay. This question looks like that related to O and G. Are
Okay.
patients with polycystic ovarian syndrome at risk of having diabetes? Are they all resistant to insulin?
They have insulin resistance. It's a central thing. In fact, we use metformin to treat them. It's a central thing. And so they are at risk of DM.
Okay, we're almost out of time. Please, Doc, what's the cause of excessive sweating with someone with diabetes that has diabetes?
It's an autonomic complication. You know, the sweat glands are regulated by what we call sympathetic. It's regulated. So once any of those nerves is destroyed, you lost control of it, especially whilst eating. That's what we call gustatory sweating, especially whilst eating. So it's a complication of diabetes and an autonomic one. But
Okay. Favor says, is Coca-Cola good for a diabetic patient since alcohol is not
it
advised?
cannot be good now. That's glucose. It cannot be good. It's totally prohibited. It's totally prohibited.
Totally prohibited.
It's totally prohibited. Yes, that is sugar at. In fact, it has a high glycemic index. It can just raise your glucose abruptly. So it's not. It's not.
It's not. Okay, let's look at this comment from Gladys. Hello, doctor. Good evening. Thank you for your advice. Sometimes this herbal medicine we are talking about works. Years back, my friend was taking different types of herbal leaves, and the sugar level was then normal. I guess you're just coming.
Well, I hope he goes to check. He should still keep checking and see a physician who would advise him appropriately, and really need to do some other investigations.
Yeah, need to follow up or other investigation to be sure that there is no problem somewhere.
No problem. Yeah.
Okay. Two more questions. I think then we are done tonight. We don't want to keep Chief staying too much.
Okay.
Can diabetes be avoided?
Yes. We've explained preventive measures that can be taken. It can. You should take the preventive measure. Yes, it can be prevented. Type 2 diabetes can be prevented.
It can be prevented. Type 2 mostly.
It can.
Type 1. Yeah. What are the best drinks for a diabetic patient? This from our joker.
Drinks. What do you mean by drinks? I think water.
Water.
Yes, like drinks. A lot of people say low calorie, but we don't believe in we don't believe in that. There's nothing like low calorie. They all have calories.
So, have calories.
Yes.
Okay. Okay. Please, doctor, can you tell us some food that's good for diabetic patient? Because if I take this, they will say sugar is inside. Even they told us to roast rice before cooking it. Wow. Okay.
To do what?
Food. Say the food for a diabetic. What food should a diabetic take? Because they have been advised to avoid certain food because of the sugar content in the food.
Yeah. Well, about nutrition in diabetes is a whole lot of topic. Yes, but we usually say that the word is nutritious. The things you should avoid totally, actually, glucose drinks, juice. Those are drinks that are in that are glucose that will rapidly be absorbed. But other food like yam, you can take them with a lot of vegetables, but then the quantities for diabetes should actually get a prescription from the dietitian. So there are no hard and fast rule about me. You can get a prescription from a dietitian who will put other things in consideration, like your cholesterol, your daily activity, your cholesterol, your weight. What they are going to give to somebody who is fat, who is diabetic and fat, will not be the same calorie with somebody.
My own network. Okay, we are back.
A diet that will make the person gain some weight. Somebody who is fat, they will prescribe a weight reducing diet. So a dietitian does the appropriate prescription, but there are no thing that does the appropriate prescription for you as a diabetic on the meals you should take.
Okay. Sir, can you hear me?
Yes, I can hear you now. For example,
Okay.
I tell my patients that look, if you must eat rice, take small quantity of rice, take more beans, put a lot of vegetables, small rice, small beans, put a lot of vegetable there so that you are full. So basically, as for nutrition, a dietitian does the prescription for you, taking into cognizance a lot of things from your weight to your cholesterol level to your daily activity, and puts all those in mind while they do a prescription, a dietary prescription for you.
It's important to see a dietitian to help you with your
Yeah.
prescription. We are rounding up now. The last question, I think we've addressed this, but let's take it for Oluwakeni. Is weakness of the hands a symptom of diabetes?
Weakness of the hand. What depends on what you call weakness of the hand. Is so the weakness is so vague. For example, if you have paresthesia, if you have a weak hand that you cannot even move, can come from a mononeuropathy. It can be proximal muscles, it can be, let me just say, because diabetes causes proximal myopathy. So, for example, if you can't even comb your hair and your proximal muscles are weak, it can be. So it depends on part of your muscle, or so those are things we cannot really answer until we see the presentation and how you are presenting. That we can say, but it's possible to have proximal myopathy with diabetes, and so such persons cannot even comb their. They are weak. Their hands are weak when they are combing their hair. In fact, some from the sitting position, standing up, they find it difficult. That's proximal myopathy, and it can be caused by diabetes.
Thank you very much, sir. As we round up, sir, what will be your final words for those of us listening who are not diabetic and those of us who need this information to protect ourselves from coming down with diabetes? What will be your general advice, sir?
My general advice to the normal population who are not diabetes is that diabetes, type 2 diabetes, is preventable. And that even though we have a lot of things that can assist us with our daily activities, we should still try to do some exercises. They may not be vigorous exercises. Dancing is exercise. Taking some steps is exercise. Rather than relying on machines to do everything for us, we should try and do some exercises and eat healthy. We should go back to the olden days where people eat vegetables and
Vegetables, yeah.
all sorts of fresh fruits rather than eating a lot of fried foods and the rest. Those are lifestyle changes is very vital. So everybody, not just diabetes, so that if we know we're not doing that, we should try and now to exercise and eat healthy.
And it's healthy. If you are just coming, sorry, you might have to watch this video again from the beginning so that some of your questions have been answered. This one says, can someone with diabetes have a successful pregnancy? Yeah.
Of course, if monitored, yes, yes. Of course, because the person knows that he has diabetes, he would go to see a specialist, gynecologist, and an endocrinologist who would manage. If well managed, people deliver, of course they do. But then it must be well managed by specialists from antenatal onto delivery. They can have a successful pregnancy and delivery.
Yeah, they can have a very successful pregnancy and delivery. Thank you so much, sir, for coming on this platform tonight, talk about diabetes. We are so grateful. And this session has been
Thank
very,
you,
very
Dr. Fred.
insightful. Spoke about the different types of diabetes, the type 1, type 2, gestational diabetes, the ones caused by drugs and other medical conditions. We are so grateful, sir. And I hope that people
Thank you,
would
Fred.
learn. We'll share this video on Facebook and also on YouTube so that people can get this knowledge. We are grateful. Thank you once again for your time, sir.
Thank you, Fred.
Dr. Israel,
Good to see you.
we are grateful.
Yes,
So any other
okay.
questions any other question you have for us? We've addressed it before. Nigerians won't watch educative programs like this. Please help us share these videos. Share the videos on your platform. It's important. These are the reasons why we come here to empower you with the knowledge. It's all about awareness. Thank you very much once again, sir. We are
Thank
truly,
you,
truly
Fred.
grateful. If we are to pay, we can't pay for
I'm
this
happy to
now.
be.
We can't pay.
Fred,
Thank
no,
you,
are you hearing
sir.
from your? Are you hearing from your man?
Yeah, yes, yes, yes. Once I hear from him. I hear from him. Yes, sir.
That's good. That's good. That's good. You're doing a good job. In fact, most times I see your clips everywhere. I told you that on TikTok, everywhere. In fact, in one group I belong to, they post and say, hey, "This is my friend." That's good. You're doing a good work. You're doing a good. God
Thank,
bless you and your
thank you,
crew. God
thank you
bless you
very
and
much,
your
sir.
crew. All right,
Thank
Fred.
you, sir.
All
We
right, Fred.
appreciate you.
So happy to see you. God bless you and your crew.
Have a
Cheers,
wonderful
guy.
night, sir. Take care, sir.
No
Bye bye,
problem.
sir. Ladies and gentlemen, thank you. So this program is every Sunday by 8 p.m. 8 p.m. Nigerian time. So if you come late by 8:30, 8:45, you might have missed a whole lot. Thank you once again. Help us share this video. Invite your friends to come here and join us. This is what we do to educate our people. God bless you. Thank you. Like I always say, good life now waiting. Good life now sense. I want to appreciate my co-host, Dr. Israel. Irobono said he had one or two issues in the network. And then Dr. Blessing Arimir, Dr. Blessing couldn't join us because he has been very, very busy at work. But when they are available, you'll see everybody here tonight on the platform. Have a wonderful week. Bye bye.